Imagine you're sitting in a dentist chair right now. The drill is spinning, the suction tube is humming. You're gripping the armrest so hard your knuckles are white. And your dentist, cool, confident, trained for 8 years, leans over and starts working on one of your back molars. Now imagine that same procedure, same tooth, same precise circular drilling into enamel and dentin. But no chair, no electricity, no anesthesia, no sterile instruments, no training program, no medical school. Just stone tools, raw skill, and a patient sitting completely still while someone drills into the hardest substance in the human body. 9,000 years ago. This is not a theory. This is not mythology. This is not a fringe idea from a book nobody peer-reviewed. This is documented in a study published in Nature, one of the most respected scientific journals on the planet, based on the physical remains of real human beings excavated from a Neolithic graveyard in what is now Pakistan. And I want to be very clear about something before we go any further. The question this discovery raises is not, were ancient people smarter than us? The question is far more uncomfortable than that. The question is, how badly have we underestimated them? Stay with me, because what I'm about to walk you through will completely reframe how you think about prehistoric human capability, and it's backed by hard, physical, microscopic evidence that you can look up yourself. Let's explore this right now. There's a place in modern-day Balochistan, Pakistan, called Mehrgar, and if you've never heard of it, that's actually a significant part of the problem. Mergar sits along the Bolan River in the Indus River Valley. It's one of the earliest known farming settlements on Earth. People were cultivating barley and wheat there, domesticating cattle, growing cotton, and building permanent structures. All of this happening between roughly 7,000 and 2,500 BCE. That's not just before ancient Egypt as most people picture it. That's thousands of years before most of what we casually call early civilization. Now, archaeologists have been excavating Mergar since the 1970s. They've uncovered over 300 graves in a single Neolithic cemetery alone. And inside those graves, alongside pottery, ornaments, and animal bones, they found something that nobody expected. They found teeth. Not unusual, right? Teeth survive for thousands of years. Archaeologists find them all the time. But here's the issue. These particular teeth had holes in them. Not random holes, not damage from soil pressure or post-mortem decay. Perfectly shaped, precisely circular holes, drilled deliberately into the molar crowns of living adults. In a landmark study published in the journal Nature in 2006, a team of researchers described 11 drilled molar crowns recovered from 9 adult individuals in the Mergar graveyard. The dating of these remains places them between 7,500 and 9,000 years ago. Think about that number for a second. 9,000 years. The previously accepted earliest evidence of dental drilling came from a Neolithic site in Denmark, dating to around 3000 BCE. That's approximately 5,000 years ago. Mergar didn't just push that timeline back by a few centuries. It pushed it back by more than 4,000 years. That's not a revision. That's a complete demolition of what we thought we knew. But the age alone isn't even the most astonishing part. And this is where I want you to really pay attention, because the detail I'm about to share is the one that stopped researchers cold. When the team analyzed these drilled teeth under microscopes, what they found wasn't crude accidental gouging. The holes were near-perfect circles. They penetrated cleanly through the enamel, the hardest biological material the human body produces, and into the dentin underneath. The walls of the holes were smooth and consistent. This is the signature of a controlled rotational drilling motion. Not scratching, not chipping, not scraping. Drilling. So what was the tool? Here's where it gets genuinely fascinating. The research team also found flint drill tips at the same site, the exact type used by Mehrgar's craftspeople to drill holes in stone beads and decorative ornaments. These were bow drills. A bow drill works by looping a string around a central shaft. When you pull the bow back and forth, the shaft spins rapidly. If you mount a sharp flint tip at the end of that shaft and apply downward pressure on whatever you're working on, you can create sustained, controlled rotational force. In practical terms, when researchers recreated this technique in experiments using similar tools, they were able to drill a comparable hole into an isolated tooth in under a minute. Not hours, not days, under 60 seconds. That tells us something extremely important. Reflectively, this wasn't a desperate, improvised, one-time hack. This was a technique that someone had practiced, someone had refined, someone had mastered. And there's one more piece of evidence that seals this interpretation completely. Several of the drilled teeth show signs of wear after the drilling, meaning the patients lived on after the procedure. They ate, they chewed, and the holes in their teeth wore down over time. This was not post-mortem mutilation. This was not ritual. This was not decoration. These people were treated alive for a condition that was causing them pain. The researchers also noted that in at least one documented case, the drilling followed a curved path, tracking the actual shape of the cavity inside the tooth. Not a straight hole punched directly down, a curved, contoured channel that followed the anatomy of the decay. That requires the practitioner to understand the three-dimensional structure of what they're working on. That requires them to adjust the angle and direction of the drill in real time. That requires skill that is frankly difficult to describe as anything other than dental technique. Now, you might be wondering, where does the pain fit into all of this? Because let's be completely honest, if you drill into a molar with a spinning flint tip and no anesthesia, the patient is going to feel it a lot. And yet, these procedures happened multiple times in multiple individuals across what appears to be a span of many generations at the same site. Some researchers suggest that natural resins or bitumen, materials that were available in the region and have documented analgesic properties, may have been used as primitive sealants or topical pain-numbing agents. It's important to note here that this hypothesis remains speculative because organic materials of that type would not survive 9 millennia of burial. What we do know from the physical evidence is this. The people of Mergar demonstrated a remarkable level of technical sophistication and a genuine understanding of human anatomy. They identified a problem inside the body. They devised a mechanical solution. They executed that solution with precision, and they repeated it across multiple individuals in their community. Firm. That is not primitive. That is a medical tradition. And the broader context of Mergar makes this even more significant. This was not an isolated community of desperate survivors improvising under pressure. Mergar was a flourishing, organized early farming society. They grew crops, they kept animals, they traded, they made elaborate jewelry, which is directly relevant here because the same bead drilling technology they used for decorative work appears to have been adapted for oral medicine. Think about what that tells us about how knowledge moves inside a community. A craftsperson who perfects the art of drilling tiny, precise holes into stone and shell develops an incredibly refined motor skill. Somewhere, and we can only speculate about how, someone made the connection. The same controlled motion, the same steady hand, the same sharp flint tip, but instead of a bead,
you aim it at a rotting molar. That intellectual leap from craft to medicine is extraordinary, and researchers have described it as one of the earliest documented examples of specialized knowledge being transferred between disciplines in human history. This is a cultural trait that we typically associate with the rise of early city-states thousands of years later. The idea that a community could identify a problem, develop a skill, teach that skill, and apply it consistently to the health of other community members, that's a level of social organization and shared knowledge that most people simply don't imagine when they picture a Neolithic farming village. But that's exactly what Mergar appears to represent. And because of that, the question of what else we've gotten wrong about this civilization becomes everything.
Let's talk about what Mehrgarh actually was. Before excavations began in earnest in the 1970s, the Indus Valley region's pre-urban history was largely a blank page in mainstream archaeological understanding. We knew about the Indus Valley civilization, the great urban culture that produced cities like Mohenjo-daro and Harappa, with their remarkably advanced water management systems, standardized brick construction, and evidence of long-distance trade. But Mehrgarh pushed the starting line back dramatically. It wasn't just an early site, it was a continually occupied site spanning thousands of years, with evidence showing a steady, accumulating progression of technological and cultural sophistication. From its earliest Neolithic layers to its later Chalcolithic periods, the archaeological record at Mehrgarh shows a community that was actively developing, adapting, and passing down knowledge across generations. The dental drilling fits perfectly within that picture. This wasn't a single genius inventing something in isolation. This was a tradition, a long-standing, community-held practice that had enough social value to persist across what the researchers themselves described as a long tradition of proto-dentistry in an early farming culture. Those words appeared in Nature, not a personal blog, not a fringe publication, Nature. And the phrase long tradition is crucial. It implies repetition, it implies teaching, it implies that someone in this community was, in some meaningful sense, a practitioner, a person whose role included treating the dental pain of others. That's a specialist in a Neolithic community, 9,000 years ago. Now here's what most people completely miss when they first encounter this story. The mainstream narrative of human medical history typically places the origins of intentional dentistry somewhere in the ancient civilizations of Mesopotamia or Egypt, roughly 5,000 years ago. These traditions are well documented. Babylonian texts mention tooth pain. Egyptian medical papyri describe treatments for oral conditions. But Mehrgarh predates all of that by several thousand years. But more importantly, Mehrgarh predates those traditions without leaving us any written record. There are no papyri from Mehrgarh, no clay tablets, no inscriptions. What we have instead is physical evidence, the drilled teeth themselves. And in some ways, that makes the discovery even more powerful, because it means this knowledge wasn't written down somewhere waiting to be found. It was practiced, it was lived, it was passed from one set of hands to another, generation after generation, in a community that understood something profound, that tooth decay causes suffering. That suffering can be addressed, and that one person with the right skill can relieve another person's pain. That is the foundation of medicine. Not theory, not text, not institutions. The act of one human being looking at another human being in pain and doing something about it. Now, the specific detail about which teeth were drilled matters enormously here, and I want to make sure we spend a moment on it, because all 11 drilled crowns found at Mehrgarh were on molars. Not front teeth, not incisors or canines, the teeth right at the front of the mouth that you could theoretically reach fairly easily. Back molars. The teeth that sit deepest in the jaw, the teeth that are the most difficult to access, the teeth that require a patient to open wide,
hold still, and trust the practitioner to work in a confined, awkward space. The Los Angeles Times noted in its coverage of this discovery that all the holes were on teeth that would not have been easily visible to the patient's contemporaries, which means this work was being done not for cosmetic or decorative display. Nobody was drilling back molars for show. This was being done to fix something. The positioning of the holes, on the surfaces most consistent with where decay would develop, supports the interpretation that the goal was to remove decayed tissue and potentially relieve the pressure and pain of an infected tooth. And while the holes were not extremely deep, reaching perhaps 1/7 of an inch, the researchers pointed out that depth is more than sufficient to reach the sensitive nerve tissue inside, which means whoever was doing this drilling knew exactly where they were going, and they stopped at the right place. That is not guesswork. That is anatomical knowledge. I want to bring this back to the bigger picture now, because this is really what Mergar forces us to confront. We have a deeply embedded assumption in the way we tell human history. The assumption goes something like this: the farther back in time you go, the more primitive and limited human beings were. Stone Age means simple, Neolithic means basic, pre-urban means pre-sophisticated, and Mergar demolishes that assumption, not with speculation, not with alternative theory, but with a drill hole in a 9,000-year-old molar. A precisely shaped, intentionally created, microscopically verified drill hole in a 9,000-year-old molar. The reality is that human beings have had essentially the same cognitive capacity we have today for at least 100,000 years. What changes over time is not the brain. What changes is the accumulation of knowledge, the development of tools, and the social structures that allow that knowledge to be stored and shared. Mergar tells us that at least some communities in at least some regions were accumulating and sharing extremely sophisticated, practical knowledge far earlier than our standard timelines suggest. And here's the question that genuinely keeps researchers in this field engaged. If this level of medical sophistication existed here, at this site, at this time, what else existed elsewhere that simply hasn't been found yet? Or more unsettling, what has been found but hasn't been properly interpreted because we went into the analysis with the wrong assumptions about what people from this era were capable of. The evidence from Mergar didn't just add a data point to the history of dentistry, it changed the entire framing of what a Neolithic community could be. It introduced the possibility, now supported by physical evidence, that specialized medical practitioners, community health knowledge, and cross-disciplinary skill transfer all existed thousands of years before we assumed they could. Researchers describe the Mergar dental tradition as evidence of the social storage and sharing of predictive knowledge, meaning the community not only had the skill, but had systems for maintaining and transmitting it over time. That kind of cultural infrastructure, the ability to store knowledge and pass it on, is something we normally associate with literate civilizations. Mergar had it, without a single written word. There's one more dimension to this story that I think deserves attention, and it connects Mergar to the larger arc of civilization in this region. The Mergar site sits along the major route connecting Afghanistan to the Indus Valley, the same valley that would, thousands of years later, host one of the largest and most sophisticated urban civilizations on Earth, a civilization with indoor plumbing, urban planning, standardized weights and measures, and evidence of long-distance trade networks stretching across continents. Mergar is not separate from that story. Researchers who study the site describe it as part of an unbroken continuum, a lineage of accumulated human knowledge and social organization that stretched across millennia in this region, building gradually toward the civilization we know as Harappan. The dental drilling at Mergar, then, is not just a medical curiosity. It's a window into a culture that was already developing the foundations of what we call civilization, long before anyone built the first city, long before anyone wrote the first word,
long before history, as most of us were taught it, even began. And that framing, that these were not isolated primitive experiments, but genuine early expressions of a continuous intellectual tradition, is what makes this case so compelling to the researchers who study it. This is not about downplaying the difficulty that Neolithic people were dealing with. Life at Mergar was hard. Tooth infections in the pre-antibiotic era could be genuinely life-threatening. Pain was constant. Death was close. But here's what the evidence tells us. They didn't just endure that pain. They organized themselves to address it. They developed skill. They transferred that skill. They applied it consistently. They built, in the most essential sense of the word, a medical practice.
9,000 years ago, in the hills of Balochistan, with a bow drill and a flint tip, and they were extraordinary. So what's the bottom line here? The story of Mergar, ancient dentistry, isn't really a story about teeth. It's a story about what human beings are actually capable of when we stop underestimating them. We have spent decades, maybe centuries, constructing a mental image of prehistoric people as flumbling, reactive, barely surviving primitives. And site after site, find after find, the evidence keeps telling us something different. Mergar tells us that 9,000 years ago, a community in the Indus Valley had practitioners with enough skill to drill curved channels into back molars using stone tools, and their patients lived through it. That should genuinely shake something loose in how you think about history. Because if we got this wrong, what else did we get wrong? That question is exactly what this entire series is built around. Every civilization we cover here isn't just a history lesson, it's an open case file. If you want to keep going down this road with me, subscribe to OBSCURA Files right now. We post new investigations every week, and every single one is grounded in real evidence, real science, and the kind of intellectual respect for ancient people that they've always deserved. Drop a comment below and tell me, what's the ancient discovery that hit you hardest? The one that made you think, why did nobody tell me this? I read every single one. This is OBSCURA Files. The truth was always buried. Let's keep digging.